Thank you for watching the World Community Magazine's Hour of Power Live on Facebook with your host Edward McQueen and April Garner Davis.
Good evening, everyone, and thank you so much for joining us for WCM Live. I'm April Garner Davis, the show's co-host, and Brother Edward is getting his equipment situated right now. I'll bring him on the screen in just a moment. I just want to say thank you all for your support and patience. We've kind of been on hiatus for a couple of weeks, but sometimes you have to take a little break, a little vacation, some time for self-care and all of that good stuff. And so we've been just, taking a woosah moment, and we are back with a very strong topic tonight, a career in radiation therapy and its impact on cancer treatment. We have two wonderful guests with us tonight who will discuss their careers in cancer treatment as radiation therapists. And of course, it's always a goal of WCM Live to bring these types of career pathways to the public so that not only our adults who are watching will understand that, there's always a career option rooted in medicine or wherever your passion is, but also our young people who, may be looking for a career option and thinking about what they can do as a career pathway, regardless of whether or not they're going through community college or four-year university or, advanced education. There's always something out there that's needed in our world. And so we're going to talk tonight to two very educated, obviously highly educated, extremely talented persons who are working in the field of radiation therapy, and they will discuss with us their backgrounds, their education, and we'll talk a little bit about the kinds of cancers that they've seen in terms of their experiences working with patients at John Hopkins Proton Center. And so I'm going to bring on right now our special guest, Tanisha Thomas, and also Elizabeth Del Reyes. How are you?
Hello.
All right. It is great to have both of you with us tonight. We really do appreciate it. And, you're taking the time out of your busy schedules to talk to us about a topic that is very important to a lot of people and can be somewhat scary, as a matter of fact. And so hopefully the two of you will be able to shed some light on some things that will help them to understand more about this level of treatment when it comes down to cancer. And so, Brother Edward, if you will send me a private message and let me know that you are ready, I'll bring you on the screen whenever you're ready. But in the meantime, why don't we start with just some introductions of who you are? I'm going to start with Tanisha.
Okay. Hi, everyone. So my name is Tanisha Thomas. I'm the lead radiation therapist at Sibley Memorial Hospital, John Hopkins Proton Center in Washington, D.C. So nice to meet everyone.
All right. Elizabeth?
I'm Elizabeth De Los Reyes. I am a senior radiation therapist at the John Hopkins Sibley Proton Center. Thank you for having us.
Oh, absolutely. So, ladies, why don't you get into your backgrounds a little bit? Tanisha, can you tell us a little bit about how you got started, your education, and what led to this particular career field?
Well, I've been in radiation therapy for 15 years now. I've had experience delivering, cancer care to patients for, a number of years now. So I do have an extensive background, but I'm actually a former 8-year U.S. Navy veteran. So that was my first career path.
Well, first of all, I know that some people are, say, don't say that, but I'm going to say it. Thank you for your service. That is impressive. Thank you so much.
Thank you. So after getting out of the service, I just, was trying to think, what I wanted to do, my career path. So I actually started off at community college. I got my associate degree in computer design and drafting, actually, initially. But then I started looking because I wanted to find, a much more rewarding career. So then I had someone that was already in the program, and they actually started telling me more about the program. So then I decided to take a look into it, see what's, more about it. So I was able to do like a shadow day at a hospital for like a full day, which was great experience. Getting to see what the therapists, did on a daily basis, how they interacted with the patient. And when I saw that, I was like, this is what I want to do. So then when I take a look at like, the colleges and schools like that. So I went to Baltimore Community College in Baltimore, Maryland. I did a 2-year program track there. And I graduated from that program in 2009 with an ART certified, background there. From there, I went on to University of Maryland Medical Center, and I was there for 10 years, and that's the downtown campus. I did it for 10 years, and at University of Maryland, I served both as a staff and a senior therapist at their Proton Center. At their Photon Center as a radiation therapist. And then after that, I went to Walter Reed for 1 year. And then now I'm here at Sibley Memorial Hospital, where I've been doing proton therapy for 4 years. And now I'm the lead radiation therapist here at the Proton Center.
All right, awesome. Once again, a very impressive and progressive career path. And, I, for one, am particularly fond of community college. I come from a higher ed background, worked at a community college for 12 years in career services. So when you said I shadowed, I was like, yes!
It is so important. Yeah.
It is so important to see what you're planning to get into. Exactly. And that's one of the ways to make a very solid decision about what you want to do in a career path, because I promise you, I've run into students who, wanted to be nurses, and they realized they had to deal with blood and stuff. And they were like, I can't do this, Miss April. And I'm thinking, what do you think this was going to have to do with? So, yeah, I get it. So I think Brother Edward is ready. We're going to try to bring him on. There's some feedback, Brother Edward.
Yeah, Brother Edward is ready now. Some feedback.
There's feedback. So you sound like you have another browser open, or. So I'm going to bring you off the screen.
I'm on the phone. I'm using my phone. So I'll put the computer down.
Right.
Is it still there?
No, that's better. Well, I see
it's
that,
good.
but then I just heard myself.
That's better.
I
Okay.
hear myself. So if you're on your phone, you can't have your computer on at the same time.
Okay. Right. Yeah. Right. Well,
Okay.
I've got it.
To fix that, we're gonna get that in the interview. Okay. Just let me know when you're ready. Yeah, you have to be patient with him. It's been a couple of weeks. Okay. It's like going on vacation and forgetting all your passwords, right? Okay. All right. So, Elizabeth, why don't you tell us a little bit about yourself?
So I'm originally from Chicago. That's where I grew up. I've been a radiation therapist for 7 years. I don't have the same path as Tanisha does. The reason I became a radiation therapist was a little bit more personal. My grandma was really sick when I was about 6 years old. And by the age of 10, I had gone to treatments with her. And I was like, I want to save people's grandmas. And by like 10 to 12, I was like, this is kind of what I want to do. So it's a really niche field. And I made like my high school career path, like very science oriented. Mm-hmm. I knew that I wanted to go into medicine. I went to a 4-year college in Southern Illinois University, where I got my X-ray license first and then transitioned to a radiation therapist. I worked at Barnes Jewish Hospital, which is one of the big Midwestern centers in St. Louis, Missouri, where I did my clinical rotations and then was a staff therapist there. And along with working there, I also worked as a quality assurance assistant, which I helped physicists, which are a part of our team, run plans. So from the get-go, I was kind of involved in the field. After living in St. Louis, I decided that the bigger hospital was a little bit too much, especially because a year after I graduated, the pandemic came. So, I transitioned to a smaller hospital after that and kind of got like the lowdown on how smaller hospitals work. And then in 2022, I moved out to the DC area and got hired on to Hopkins. And I started off as a photon therapist and then was then transitioned into senior radiation therapist at the Proton Center.
Okay. All right. Well, here's, what I'll say about your pathway to this career. It's interesting because there's a great contrast here. One that definitely was rooted in, progressive educational, flow, and the other that's rooted in what I would say, was an ingrained passion of yours from a lived experience. Either way, it's led both of you to this particular career field. And it tells me, too, that, your choice of this career path is completely authentic, because even though you happened into it in different ways, you still landed where you are. And I can imagine that it's turned into a passion. So it probably doesn't even feel like a job to you. It feels like, you're working on purpose, right? You're living in your purpose. Yeah. And that's a wonderful thing, and I think that when it comes down to selecting career pathways and, trying to figure out what you want to do with this one life you have to live, that's really the feeling that you want to have, is that, okay, I did it because of grandma. What a way to honor your grandma. And then as well as Tanisha, just, being a scholar and actually going in and seeing it happen. And it's like, I really want to do that. So, both of you found like you said, your niche. And I think that is great. And so, you've kind of shared with us some of the lingo of your career pathways. You talked about photons and protons and all that other good stuff. And I don't know that people really understand that part of, radiation therapy or cancer treatment or what have you. So why don't you can decide who wants to do this, but talk to us a little bit about this proton, photon, whatever this therapy is all about, and what does it all mean? What's in the name? What does it all mean?
You want me to take that, or what you want to do, Liz? You want to take it?
Sure, I'll take it.
Okay.
So photon and proton therapy. So it's just they're fancy names for the particle that we use. Photon treatment is it's the version of cancer treatment that most people get, including, so like we have what are called curative cases, which there is intention for cure. And then we also have palliative cases, which what we're trying to do is reduce pain in whatever symptom the cancer is kind of causing. Versus some proton treatments, I would say about 80% of them are intended for cure. So there's one of them, like if you're kind of in pain, you're probably going to get the photon side. But if there's like a high chance of cure rate or high chance of like stopping it from coming back, you're more likely to get like a proton or approved for proton treatment. And and then the other thing too that I want to say is the energy that we use is different. So photon pH is going to be kind of it's a little bit sillier. It's zigzagging more into the tissues that we're treating, causing what's called an exit dose. So it comes out of you at some point. Versus proton, which is what we do at the Proton Center, is there is an exact distance, meaning that the beam that we're using stops right at the tumor that we're aiming at. So again, if you think about it, like the palliative care, right? So that's going to be the photon, right? We're going to try to hit everything in that area to try to reduce the pain, versus proton, the proton, is going to stop right at that curative dose or where that tumor is located.
So is it that you have patients who go through palliative care? Well, I'll say this, curative care and then palliative care, or is it the other way around, or is it just it's based on the situation?
Based on the situation.
Based on the situation. Okay. All right. So let me see if Brother Edward is ready to come on. Brother Edward, are you with us?
Brother Edward is ready to come back on. All right.
Okay. Well,
yeah. Can you hear me?
Yes, I can hear you. It sounds
okay.
Great.
Good. Fantastic.
Yeah.
Good. I'm glad these experts were talking about the difference between the two, proton and photon. When you're talking about the two, sometimes that people don't hear it correctly. they will get mixed up with photon and proton, and then they go back with different meanings, and then conversations ensue, and then it's just a huge argument. And people, well, I said, well, they told me that proton did so and so, or photon did so and so. So I'm glad you're making that, trying to make that distinction there. And we're on the air, so maybe we put it down at the bottom, April, the PROTON VS PHOTON. I maybe get that off. But anyway, so good to have you all. What did it say?
I said I don't want to confuse everybody. The science lesson. Yeah, but I think that Elizabeth did an excellent job explaining it. I totally follow what she was saying. I totally follow what she was saying.
Right.
And also,
so we're talking about different.
I think there's a bit of a delay.
We're talking about different cancers, right?
No, we haven't gotten into that just yet. Is there a delay on your end, Brother Edward?
Okay. Is there a delay on my end? No, I don't.
Okay, I just want to make sure. Tanisha was getting ready to speak, and then you were speaking, so I just want to make sure there's not a delay.
Okay.
No, okay.
I also mentioned the difference. With,
Tanisha has so much knowledge that she's ready to spill all that knowledge out.
and then the advantage.
And I'm not leaving the other young lady out, Elizabeth, out either. I mean, they both. Well, it's good. We're so glad to have you on the show. So, yeah, go ahead, April.
All right. So, Tanisha, you were going to add to what Elizabeth said.
Yeah, I was going to just add a little bit to the difference also with the photon and proton is also we spare a lot more normal tissue with the proton center, so less side effects with proton also. Versus photon, where the side effects can be a little bit more skin irritation, things like that. So we are sparing a lot more normal tissue with the proton center, with the proton therapy. And proton therapy also is newer in, the different types of modality to treat cancer now. So more and more proton centers are developing all over across the country, which is great, giving, patients more access to proton therapy as well.
How new is proton therapy?
I would say, Liz, maybe about 10 years.
Yeah,
wow. So new within, the whole cancer treatment. And when they first started, it was only 2 proton centers, one in California, and then there was one on the East Coast, which was Penn. And now, other hospitals now are developing their own proton center. So we're grateful to be working with John Hopkins at their proton center for the last, 5 years now, delivering excellent high quality care.
So let's get into the different types of cancers that you all treat at the cancer center. So I'll start with this question though. At the center, are you all responsible for baseline screenings? Or has there already has a screening already taken place, and the diagnosis called for an advanced treatment to John Hopkins? So tell me, where you are in the scheme of treatment.
Yeah. So when the patient comes to us, they already have had their diagnosis. They're already seen our radiation oncologists to get recommendation on, their course of treatment. So when they see us, where they're already coming in knowing that they're going to start off with getting, a simulation done with how they're going to be treated for, the proton treatment. So when they see us, we're usually at that stage, walking them through the process of what's about to happen with their proton treatment. We're doing initial simulation with them on that first day. We're giving them information and knowledge about what's about to happen on that day, and then, the remainder of the course of treatment. Okay.
All right. And so, as Brother Edward mentioned a little earlier, there are different types of cancers that you all, have, I guess, kind of seen in patients. And when we were talking earlier pre-show, you mentioned that it isn't just, about adult cancer. It's also pediatric cases where you're seeing cancer in children. So let's, talk about the different types of cancers, and then also, what you see in these types of populations as well.
You want to take that, Liz?
Yeah. So when people hear radiation therapy for the first time, the first thing that people kind of jump to is cancers. But there is different things that we also treat other than cancers that, I'm just going to touch base on really quick before we get into the cancer talk. But radiation can be used as a way to stop scarring. So there's times where not in the proton center, but in the photon center, there are people who get like really big keloids. So keloid removal surgery, and then we radiate that to kind of cauterize the skin, and then it won't grow back. It's not cancer. It's not a disease. It's just like to prevent scarring. Same thing with, I had a really interesting case in St. Louis where this person came in with a nosebleed so deep far into the sinus cavity that they couldn't cauterize it in the emergency room, that we did 3 treatments of therapy to their nose to cauterize this nosebleed. And again, not cancer. It was just to kind of help, stop the bleeding. So there's a slew of different things too that you can get treatment or radiation treatment that doesn't have to necessarily be cancer. When it comes to cancer, though, we are treating you can think of any organ and we're probably treating it. At Johns Hopkins, we are treating prostates, we are treating breast, we are treating chest walls, the liver, the lungs, the rectum, the vaginal canals, the bladders, the skin. We're treating arms, we're treating legs, we're treating the bottom of people's feet, we're treating the back of their necks, or you think of a place, we're probably treating it. We can treat eyes, like everything. So it's more of an interesting, once again, very niche type of place to be in, because when people kind of hear the word cancer, they think of like the big body, blood, XYZ, but it's it could be found anywhere, but it can also be treated as well. Anywhere. Like I said, bottom of the feet. Who would have thought?
Right. Okay. So you mentioned all of those areas where treatment can take place. Does it call for a different specialist for each area, or are there doctors on staff that actually have like kind of a universal knowledge of how to treat the areas that you pay particular attention to?
We have doctors that are like we do have doctors that are specific to certain sites. So we as radiation therapists treat all of it. We'll treat the lung, the liver, and things like that. But then we'll have specialty doctors who specialize in like liver treatment or breast or prostate cancer. And then they give us the course of treatment that we are to deliver on a daily basis for that patient. So we as therapists, we will treat everything, but then we'll have the specialty doctors that will give us the guidelines of how they want the patients to be treated.
Okay. And so we also talked a little bit about preventive measures at during the pre-show, and just really early measures and family history being indicators of certain things. And so what would be your best advice to viewers who may be experiencing something or are not quite sure? I'm sure you all have heard stories from your patients of, I thought it was this, but I wasn't sure, or I saw this and I wasn't sure. What are some things you can share with us as far as advice you would give to the audience members if they even have an inkling that they could be prone to cancer?
I would say get checked out immediately for, I think too, in our community, we, especially like in the African-American community, I feel like we put off going to the doctor and, thinking, oh, it's just a cough, or it will, will go away on its own, or things like that. Because I have heard stories, like I always ask our patient, how did you find out that, you had this? And they're like, oh, I had this cough for like 3 months or 4 months. And then finally they got checked out and then found out they had the diagnosis for like head and neck or something like that. So, being in the field and hearing these stories, I definitely, for me, if it's something, I was like, immediately go get it checked out. Don't wait. Don't be scared to go to the doctor, because honestly, early detection, highly likelihood that it's curable, that we can treat it. Cancer treatment, radiation treatment have come a long way. So please do not wait, to get checked out by a doctor, to get diagnosed. Once you're at that age, to get your pre-screening, if it's mammogram for colon cancer, do not put it off. Get your screening done. Definitely, if you have, a history of like breast cancer, early on, go and get tested to see if you have those markers. There is so much options out there, and so much information out there, and different types of treatment and things like that. You want to be able to educate yourself on what's the best type of treatment for you, where to go, and you don't want it to be a last minute thing that you're rushing to get done, and then you end up somewhere where you really don't want to be. So that's my advice.
How large is the John Hopkins network?
Very large. They're all over the United States, internationally. They're in Dubai, they're overseas. So we have, which is the largest one, which is, everybody knows, John Hopkins downtown, Baltimore, which is, well known there. But, we also have satellite centers. We have Green Spring, we have Sibley, you have Suburban, which is in Bethesda, not far from our hospital. So the network is large and we treat everything, and we will take care of all types of cancer.
Brother Edward, do you have any questions? I mean, you were responsible for these wonderful guests tonight.
Yeah, I want to know, like, how far do you think that radiation has come in order to be as successful, from what I've seen, in the successful cure rates that exist today, in the past 15 years, maybe?
Extremely.
Either one of you can elaborate on it.
Yeah. I mean, if you think back to how radiation was discovered, I mean, radiation was used for fun. People used to take x-rays of their feet to see what shoe size they needed. And then later on, they found out how dangerous that was. So in perspective, it's come a long, long way. We have done, at least even at Hopkins and where I used to work at Barnes, there's extensive research that is being done. And that's kind of what Tanisha was saying earlier too, about like our specialist doctors. Our doctors are constantly doing research, and that is the key and the most important thing about understanding cancer, is understanding where it's coming from, how it's coming to communities, where they're living, what's happening to them, along with how to properly treat it and what's the best dosage for whatever cancer they're experiencing. So there are the prime reason that we're able to have like all this research on top of other people in the clinic. So then you have medical physicists, which what they do is they study the machine and how it delivers the treatment. And they are also doing extensive research, which I was luckily a part of, about how the machine is properly delivering to the part of the body that we need it to. So just as much as we need the radiation to work, we also need to be relying on a machine to be aiming correctly at what we're hitting. How can we accurately say that we hit the target? So it's like research from physics, from physicians, from dosimetrists, even, who come up with the plan idea, or it takes an entire community of us to kind of come together and do this one job per patient. And there's just a lot of research. So to say that in the last 10 years, only proton treatment was just up and coming, to see what it's done in 10 years, I cannot wait to see what the next 10, 15 years. I mean, like 10 years ago, we were still using x-ray film, like where you hold up the film onto the lens to see if your phone is accurate, or now we have computers that instantly take your CT scan within a minute or two and we don't have to wait to go process our film, our, hunky-dory film. And like, who knows what that's going to be like in 10 years from now, how quickly our scans are going to be. I mean, even now we take CTs that are 15 seconds. Like, wow, it's incredible. Yeah.
Wow.
Can you talk a little bit about the prepping, for example, if you were doing shooting some dosage of proton or photon, whatever, for the prostate or the liver or whatever digestive area down there. Talk a little bit about the prep that's required before you get under the proton or photon machine.
What I would say was like the prep
and the diet. Okay. Yeah.
Yeah. Like, so with our prostate patients, how we will treat that is definitely, because we're in that area, you have, your bladder, the rectum, all in that one area. So for our prostate patients, we do give them instructions on, how to properly fill the bladder, so that they can be at the adequate, levels that we need them to be for treatment. So before they even start treatment, we kind of the nurse will give them a little bit of guidance on, their prep, like what to eat, what not to eat, so that area can be as stable as possible. So there is not a lot of like gas or anything in that region, because we want it to be something that all we want to be able to do is just, target the prostate. So the prep is very important. So about 30 minutes before treatment, we'll have the patient, probably drink about 24 ounces of water, and then let the bladder fill. And then when it's come time for them to come into the treatment room, then they're ready and prepped. And then we will take them into the treatment room. We lay them on a table, and then we'll align the patient correctly. And then we'll step out, and then, we'll analyze that. So yes, we give them the prep, but then we'll come in and analyze it. And like Liz said, we do what we call a CAT scan, 15 seconds, and we're able to see internally what's happening with the patient. So we can able to assess, was the prep good enough? Do they need any more prep work? If they need to come off the table, properly prep, or are they good enough that we can continue with the treatment? So education is very important. And one of the things as radiation therapists that we're responsible for is educating the patient, especially on the different sites of where we're treating, giving them that proper instruction so that, to have success daily. We treat, Monday through Friday, and we treat the patient for probably 6 to 8 weeks. So they see us every day for treatment. So we do build a rapport with the patient, we help them, we guide them on, the proper prep, so that once they get on the table, they can just get the radiation and, within the time that, is allotted for them. But if not, we do give them time to, maybe adjust the prep a little bit.
Mm-hmm. So I have a question that's come through via text, and I don't know if you're able to answer it, but one of our viewers tonight wants to know if you can touch base on the stages of cancer that you've actually treated through radiation therapy.
You want to take that, Liz?
Yeah. So there's typically 4 stages of cancer for any kind of cancer. Stage 1 means that it is like contained in the spot of where your cancer is located. So for example, if we're talking about a lung cancer, stage 1, it's only in your left lung and it's not touching anything else. It's kind of just in its spot. And that's usually stage 1. Stage 2, then for that lung cancer, for example, means that it's kind of in the left lung and it's also kind of spread into some of your what's called lymph nodes, meaning that the lymph nodes near that area are also being attacked, because that's how cancer spreads, is through your lymph nodes. So it'd be that means like 2 or 3 of the lymph nodes are being attacked. Stage 3 would be anywhere from 4 plus lymph nodes being attacked, meaning it's kind of in your lung and then it's in like 10 or 12 lymph nodes as well. So we really have to do something about that. Stage 4 means it has metastasized, meaning that it has spread to a different part of your body. So in this case, for the lung cancer, it would be stage 4 would be in the lung, in the lymph nodes, and for example, on a rib. Okay, so now it's not called rib cancer. It just means it's stage 4 lung cancer with metastasis to XYZ bone. Could be your rib, it could be your clavicle, it could be your brain even, it could be your colon. It just means that it has now touched a different area of the body, and it's the lung cells that are in that different area of the body. So you could have stage 4 lung cancer in your rib because there's lung cells in there that are not properly being cells. Like they're just all over the place now. So really the stages means how far along is it? And obviously the greater the stage, the kind of not great of a prognosis you are in, just because it's in different areas at this point. It's not just in the one singular spot of the lung. And then you could take that information and apply it to like everything else. So same thing with bladder cancer or like eye cancer or, throat cancer. Like where else has it gone? Is it, so it's all in the chain of lymph nodes.
Got it. I'm sorry, go ahead, Brother Edward.
Oh, okay. I was about to say that I know a gentleman that has had stage 4 cancer for almost 20 years. So we're talking something that that radiation can do wonders. I guess along with other things like chemo, I guess.
Yeah.
But I find that to be quite interesting because usually stage 4, when you look at stage 4, people look at that as a death note. So
right. We have to change that perspective. Cancer is no longer that death note. Back to what you were saying is like they've lived with stage 4 cancer for 10 years. That's when palliative care comes in, right? So every 5 years, that person might have a flare up in their back. So then they'll get photon treatment to kind of help with that flare up. And then they'll be fine for the next 2-3 years. And then they'll have another flare up in their leg this time. And we definitely see patients like that as well. So again, it kind of just depends on like stage 4, again, just means it's in different areas, like in your body, and it's the same cell. So if your prostate cell is now located in your arm, that is still prostate cancer with metastasis to the arm. Not a new diagnosis. It's still prostate cancer with metastasis to the arm or yeah.
Well, that's particularly fascinating that the cancer cells can travel like that. And are they traveling via bloodstream, muscle tissue? How are they getting around?
Lymph node. Yep.
Yeah. Lymph node. Okay, the lymph nodes. Okay. And I know that we touched earlier on the fact that, you all have seen, radiation therapy or have done radiation therapy for adults and also children. And there's a question in the comments that kind of leads into, at what age should a man get a physical? I'm sure that you all have an idea and probably have heard, through your education, at what age a man should start. But I'll even go farther to ask, what's like the youngest age you've seen in a patient? And, should we even kind of change our mindsets about the fact that you could be too young or, to have a screening and actually have a cancer diagnosis? So talk a little bit about that.
Well, as young, oh man, we treat
1-year-olds,
2 months old, 3 months. Yeah, we treat babies under anesthesia. And of course, those, their diagnosis comes from, eventually something is happening with the kid, and then they'll get, scans and things like that. And they will find, that, like if they do a CT of the brain, then they might find that, oh, there's something going on there with that kid. So we treat as young as, 1-year-olds,
10-month-old,
all the way up. So cancer, it's unfortunate that hits everyone. It can hit anyone. And with our kids that young, we do treat them under anesthesia, so they're already under and things like that. And as far as like when should you get a physical, that should just be something ongoing, like your whole life, like from kid to adulthood. Do not be afraid to go to the doctor and get your checkups. Do not put things like that off. Make sure you're getting your yearly checkups. It's very important. So
that tells me that it was such a young age that accuracy is very important in your all skills as being therapists, right? Radiation therapists. You can't make them. You can't be off just a millimeter, can you? When you're implementing that, right?
Right, correct. So even with our babies, that's why we put them on the anesthesia, because they need to hold very still. They have to be, because it's very targeted and it's very accurate.
Right.
So we want them to be in a state where we can deliver the treatment accurately, correctly, and give them the best treatment that we can. So.
Right. Yeah. So now you want to talk a little bit about the ongoing diet for the different cancers. I know they are probably stipulated by the accompanying physician of that profession. For example, if you're talking about the liver or digestive system, then that takes more than just a primary physician, I guess, to kind of tell you about the diet or profess a particular diet.
Yeah,
my understanding is that, and I'm bringing this up because as recent as this morning, this morning I was reading something about the impact of red meat on a daily basis. I mean, not in moderation, but people eat it, daily. So can you talk a little bit about that?
I mean, when it comes to diet, when you're under cancer treatment, it's very different, actually. It's kind of the opposite of what you would think. So we actually tell you to avoid like fruits and vegetables that make you gassy. So even though beans are really good for you, we don't want your body full of gas when we're treating you, because what that does is creates pockets of air in tissue that we're treating. And we don't want to treat the air, we want to treat the tissue. So there's times where we ask patients to have a more bland diet with less vegetables, which is kind of silly. You'd think, oh, I need to be healthy, I have cancer, I just need to eat vegetables.
Wow. Yeah.
No. And on top of that too, we don't want you losing weight. So like, it's when you have cancer, it's not the time to lose weight either. We don't need your body to shrink, because if it's shrinking, that means that your insides are changing as much too. So there's times where we ask patients to avoid fruits and vegetables, to avoid beans, to avoid like buffet style dinners. Definitely don't do that to us. Just because we have to work around it, right? Like it's fine, we can do that, but it just kind of, you have to put the patient has to put their effort in, and then we also have to put our effort in. And then on top of that, there's some cancers that we treat that they cannot eat for 4 or 5 hours prior, because, for example, like if we're treating a stomach and someone just had Taco Bell or whatever, that stomach is going to be bigger, right? That means we have to treat a larger portion of it. If the stomach is empty, it's smaller and more, put together, and we can aim at something like that. So that means no food or water for 5 hours, depending on what is going on. So it kind of just depends on like where you're at. So again, same thing with the stomach cancers. Again, no fruits or vegetables, anything that's going to bring that gas. We don't want you to drink sodas before you come in. Anything that's going to give you that carbonation. Anytime you have a cramp, we don't want you to eat that food. So if you're like, oh, I'm lactose intolerant, but I really want ice cream, avoid it. Don't do it, just because that could affect your treatment the very next day. Oh, and just sorry.
Go ahead.
Like Tanisha was saying too, if a patient does come in with gas or, something along those lines, it's all about patient safety. At that point, we cannot treat something that we do not feel is going to be accurate. So we do not turn that beam on. We get the patient down. We say, hey, you've got some gas, either start walking, you need to burp, or you need to release gas in the bathroom, or, have a bowel movement or release your bladder. It's too full or not, it's not full enough. So it's all about patient safety. So not only are we shooting for accuracy, but we're also, number one important thing is patient safety. Are we hitting what we need to be hitting? And is the patient safe? Would we receive a treatment like this?
So I know that we're kind of coming up on time now, but I definitely want you to give the audience some information about, how they can find out more about Hopkins Medicine. And of course, I'll pull the website up. And to my understanding, your particular emphasis is the Kimmel Cancer Center. So if they go to hopkinsmedicine.org, they can search Kimmel Cancer Center, and I'll put that on a banner in just a moment. But when they go to this website, what's some information they'll be able to see and as they're trying to search for answers on what their next steps may be?
I would say when you go to the John Hopkins Medicine and then .org, we do have different centers. So we do help patients in the demographics in the areas that they are in. So there's a lot of centers that will be close to them. Definitely, if for some reason someone's in Baltimore and they want to come to the Proton Center, there is also assistance for that. Also, there is help that they can get financially, depending on their situation, hotel stays and things like that, if they are coming to our Proton Center. So there is a lot of information on the website of the different sites that we have throughout the John Hopkins. So it's definitely be information there. They'll be able to see information on the doctors, radiation oncology, whether it's photon or proton. And they could just click on any one of them and they will get some information, reach out to us, and then we'll get them to the best area, the best sites for the cancer that they're looking for.
All right. Well, Brother Edward, I've learned a lot tonight in the form of radiation therapy and its impact on cancer treatment. And I tell you, these ladies are certainly superstars at what they do. And I learned earlier that, they definitely have come into their career paths in different ways. Lisbeth, passion based on family experience, so a lived experience, and Tanisha, curiosity, going to a hospital to shadow one day and realizing that's what I want to do. And of course, when you are looking for career options or trying to think about what your next path will be, or what your purpose is, that's really what it's all about, is digging into your passions and learning more about career fields that are intriguing, and especially those that are sustainable, because this type of career path is definitely a sustainable path. It's the kind of thing that we're probably always going to need, especially with all the developments that Lisbeth talked about and the evolution that you all have seen in just the past 10 years. To your point, imagine what's going to happen even in just the next year or 5 years. So, we definitely appreciate the both of you being here tonight to share your career experience and to give us more information about your backgrounds and also the types of cancers that you all have experienced through your patients and the work that you do in order to, eradicate symptoms and to just provide care and healing for these patients is absolutely remarkable. So thank you so much. And Brother Edward, you want to have some closing remarks at this time?
Well, I'm just so thankful that we got such a cadre of knowledge this evening. That so I figured it to be kind of it's not hidden, but it's not well propagated out in the public, especially in our community, about the different different radiation that gives people different options. Okay, and people just take whatever one person will tell them whenever they need to have something addressed, like a cancer or whatever, and that's it. But sometimes they don't do a little homework, or they don't go and try and say, well, I'm gonna get a second opinion, or whatever option do I have, and to a lot of times that leads to their demise, and it hurts when that it was preventable, and it didn't have to be that way. So I think these are some of the reasons why I think they're so important, April, to have these two experts on the show here. I'm going to call you experts, right? So
that's what they are. They're experts.
Experts on the show tonight. Mm-hmm. Yeah, they're experts, and you, yeah, absolutely. So you're a lot of people's lives are in your all's hands. I mean, because you're implementing these different radiation procedures, and and that's important. So that's what I'll say about that. Thank you all so much for coming on. Really appreciate it. And
thank you for having us on. Thank you
for
having us on. Yes.
Yeah. As a follow-up, April. As a follow-up, we just talking about the radiation, 4 different cases this time. So in a couple of weeks, and maybe 3 weeks, we're looking at having one of the doctors from the John Hopkins Hospital Medicine Center to talk about prostate as one of them, but it could be breast cancer also. But this particular doctor would be prostate, and people should tune into that because he can reveal a lot of things that that a lot of options that are workable and saving people's lives, and just isn't out there, okay, in certain neighborhoods. So that's the name of that tune.
All right, well, that's a great tune, Brother Edward. Thank you so much, and especially for the focus on medicine. Like I explained earlier, that's what we're here for. It's grassroots, it's education, medicine, government, you name it, community, and of course, we love bringing this type of information to our audience members. And we just want to thank our audience members for watching tonight. There was 1 or 2 comments in the thread, but we know that others are watching. We get text messages, we get comments, long after the show. And of course, you can catch the replay of this on wcmagazine.net. You can also check out our YouTube channel. Make sure you pass this broadcast on. There's a share button on the YouTube channel. You can also view it for another week on wcmagazine.net. It's on the World Community Magazine's Facebook page for the next week, and even after that. So please share this information. It could save a life. And so we again thank you, Tanisha and Elizabeth, for being with us tonight. And Brother Edward, I don't know about you, but I'm going to grab me some popcorn and a nice cold beverage and get ready for the debate. And so it's at 9 p.m.
Because that's what it's going to be. It's going to be a theater. That's what it's going to be.
Oh my gosh, I'm sure it's going to be something. I don't have a word for it, but I will say this because we are a nonpartisan show. You owe it to yourself to actually tune in to debates and any type of information that you're getting that gives us more information about the platforms of the candidates. And that's, national, state, local elections. It does not matter. If there's a debate, tune into it and take your notes. Of course, it's going to be a stage. So like Brother Edward says, I'm sure we're going to see a lot tonight. But, listen to the things that are important to you and make your decisions at the polls. Okay, so we just encourage everyone to, of course, watch, and because this is a very important election. But more importantly, it's just a part of our civic duty to make sure we're educated about the candidates and their platforms. And so we just want to thank our guests for being here tonight. We want to thank all of you for tuning in. And hopefully we will see you next week, same time, 7 p.m. next Tuesday night. And until then, we just hope that everyone continues to have a great week, and we'll talk to you soon.
Thank you.
All right. Thank you all. Thank you all. Yes.
Godspeed.
And so, yes, Godspeed. All right.
Thank you for watching the World Community Magazine's Hour of Power Live on Facebook.